Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsor, Aultman Health Systems. Today, Brad and I are broadcasting from our administrative offices, and our special guest is Dr. Jeffrey Cochran with Aultman Orthopedics and Sports Medicine in Massillon. Good morning, Dr. Cochran, and welcome to the show.
Good morning.
All right, back problems are among patients' most frequent complaints to their doctors. Nearly 65 million Americans report a recent episode of back pain. Some 16 million adults, or 8% of all adults, experience persistent or chronic back pain as a result and are limited on certain everyday activities. Back pain is the sixth most costly condition in the United States. This morning, we're going to talk with Dr. Cochran about prevention and treatment of spine pain, as well as areas of specialization at Aultman Orthopedics and Sports Medicine and Aultman's Back and Spine Center. We'd like to remind our listeners today that our program will be available on our podcast. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe.
So, Dr. Cochran, again, welcome to the show. Please introduce yourself to our audience and tell us about your background.
Well, thank you for having me. I'm a board certified orthopedic surgeon. I specialize in adult spinal disorders. I've been here in Stark County since 1983 when I first arrived as a medical student at the old doctor's hospital and did my rotating internship there and orthopedic surgery residency. I then went on to do a fellowship in adult spinal surgery. I just began my 33rd year in practice here in Stark County.
Wow.
I'm currently a member of the Aultman Orthopedics and Sports Medicine practice. We are 7 board certified physicians, 1 primary care sports medicine physician, and then 7 orthopedic surgeries. My practice partner here in Massillon is Dr. Daniel Moretta, who has been my partner for all of my 33-year career. We have offices at North Canton and Alliance. And in addition to our physicians, we also have physician extenders, physician assistants, physical therapists. And we also have orthopedic surgery residents at our clinic that are working through Aultman Hospital.
So, Doctor, what drew you to orthopedics as a specialty?
Well, as a young aspiring physician in medical school, we're exposed to all the different specialties. And when I came out to Doctor's Hospital after the classroom work to start working in the hospitals, orthopedics was the 3rd rotation I did after obstetrics and pediatrics. And it fit my personality. It's treatment of disorders that are more in healthy people than non-healthy people, people that I could really make an impact in their life to get them back to healthy activities, back to work, sports, all the types of things that we enjoy doing here as adults. I enjoyed pediatrics, but orthopedics really fit me well. And after that rotation, I made the decision to pursue it as a career.
A lot of crying babies in the pediatrics. I guess,
Yes.
Is that probably part of the reason you left that or didn't want to do that?
It's just a different type of practice. So.
Yeah, sure. So you mentioned Aultman Hospital Orthopedic Surgery Residency. Can you explain that to our listeners?
Sure. So as a part of medical training, after a college degree, we go to medical school for 4 years. Back when I trained, we did a 1-year rotating internship, as I mentioned, where we rotate through all the different specialties. And at that point, you would decide to go on and specialize in a certain area: pediatrics, orthopedics, internal medicine. At Aultman Hospital, we train residents in a lot of different specialties, because being in orthopedics, I train orthopedic surgery residents. So they come to us and they work for 5 years under the supervision of the physicians here at Aultman Hospital to learn to be general orthopedic surgeons, which means they are qualified to go out and practice independently at the conclusion of that 5-year program.
Gosh, that is
I
a
happen
lot.
to be the program director, which means I kind of supervise or oversee all of the different training and evaluation programs and report to the national accrediting bodies. I've been doing it now for 24 years, so
That is a long time.
it is an exceptionally long time.
4 medical school, 4 college, 5 residency. Am I right?
Yep.
Gee
And
whiz.
then if they choose to do so, go on to a fellowship for an additional year. So people ask me how long I went to school. I tell them I went to school longer after I graduated from high school than I did before.
Yeah, that's interesting. Wow. Okay.
All right, doctor, can you talk about your role in orthopedic surgery residency?
So as a residency trainer, and then as the program director, I have 2 jobs. Number one, to teach the residents as a trainer, and that involves the science of orthopedic medicine and the practice of orthopedic medicine, both surgical and non-surgically. That means that the residents will be with me from the morning rounds through our formal education periods. They attend surgeries with me, and throughout their 5 years, they go from being an observer to an assistant to a qualified assistant to an independent surgeon. And they get to the point where they can do the surgery and I stand and assist them by the end of their 5 years. As the program director, again, I'm kind of the figurehead. I do all the administrative work. I sign all the certificates and report to the national organization, the American College for Graduate Medical Education and the American Osteopathic Orthopedic Association. So my role is twofold, both administrative and then the teaching.
Okay. So did you complete a fellowship?
I did. Again, after I completed my orthopedics at Doctors Hospital, I went to Cleveland at Lutheran Medical Center. At the time was Cleveland Spine and Orthopedic Center. Now it's a part of the Cleveland Clinic system. And during that year, I was exposed to advanced techniques in treating spinal disorders. Everything from fractures and dislocations to day-to-day degenerative joint disease or degenerative disc disease, herniated discs, and tumors. And when my young residents ask me about doing a fellowship, I tell them that 1 year of intense study gives them probably 10 years of practical experience that would take them if they just went out and tried to learn all this on their own. We all have exposure to the specialties during residency, but to get to that point where you can offer more advanced techniques, the fellowship is crucial.
Okay, so looking at your fellowship experience, do all of those examples you just listed translate to the spinal disorders that you treat today? Or what do you see today in your practice on a regular basis?
So again, we commonly see the common things. We occasionally see the more rare things, but the most common thing I see is the patient that comes to see me for back pain. And it's not truly a diagnosis, but a symptom. But it's kind of the lead into everything that I see. The spine is a very complex structure. It's a combination of muscles, ligaments, tendons, bones, discs, nerves, all of which can cause multiple different symptoms. So the first thing I do when I see a patient is I get a history. When did your back pain start? Is it something that happened after an accident? Is it something that happened after an illness? Is it something you've been dealing with for 20 years and you just got tired of it? Or did something change last week that made you come to see me? So that's probably the most important part of the evaluation of a patient that comes in for any disorder, but obviously in my situation, it's the back. I also see neck and thoracic pain. See a lot of people come in with leg pain and they swear it's their hamstring, but it takes me a few minutes to really convince them that it's not your leg, it's your back that's causing that. So,
Wow. I guess it's time for our first break, Doctor. You're
all
listening to
right.
Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Friends, just a reminder to stop by the pharmacy and talk to our pharmacist about our new Health Matters drug savings program. We want to help you stay well and save money. So, Doctor, what are the best ways to prevent back and spine pain? I guess I sort of know some of that, but after having to fix me up, but
Okay. Well, I think that it's important to stay active. Like I said, the spine is a complex combination of structures, but staying active keeps the muscles strong. It keeps the joints and discs flexible, which can decrease pain. Maintaining ideal body weight. There is a great deal of literature that tells us that patients that are overweight, because normally those patients aren't quite as active, and also the change of the biomechanics of the spine can lead to back pain. And one we hear from all of our doctors is avoid smoking. Smoking affects the way our bodies deliver oxygen to the different tissues, and injuries to the spine and general health of the spine is very much dependent upon good blood flow. So those are the three major things that I would tell my patients.
So how do you care for these patients? I mean,
So,
I know there's multiple things you can do.
Right. So I think my job is threefold. The first thing that I need to do is make a diagnosis. The second is to educate the patients, and the third is to establish a treatment plan. So the diagnosis, as I mentioned earlier, is based on initially a history taken from the patient, a physical examination I do at the time of visit, and then different diagnostic studies that may include X-rays or will include X-rays early on, and then may include MRIs and CAT scans later in the process once we have a better idea what's going on. I think education is really key. Many patients are afraid of back pain because maybe their parents or their aunt or uncle had quote unquote back problems in the past, and at the first symptom they kind of freak out and they stop doing things, and they don't want to they don't want to harm themselves. And I think it's very important to patients to understand that pain is a symptom. Pain can be controlled with activities, modifications, with exercise. It doesn't mean they're doomed to a life of back pain. The statistics mentioned at the introduction about episodic back pain is very true, but 90% of people get better without an operation, and it can be very simple. I'll recommend then for treatment, activity modifications, exercise, weight loss. We'll use typically non-steroid anti-inflammatory drugs as a first line medication. An example of an over-the-counter non-steroidal anti-inflammatory drug is ibuprofen. Aleve, things like that can be very beneficial at the initial onset of symptoms. And then I will, I will recommend physical therapy, where the patients, a lot of patients tell me, well, I'm active all day at work. Yeah, but you're active the wrong way.
Yeah.
We want to teach you how to care for your back. We want to strengthen the core, teach you good ergonomics on the job site. All those things go together to help get through an episode of back pain and prevent future episodes.
I'm glad you covered all that, because we have patients that come in the pharmacy and they talk about their back pain, and I feel like sometimes they're afraid to seek care because they're afraid of the S word. They're afraid of the surgery word, and it's one of those things where they don't do anything then. And then everything you just described, it maybe sends them down that rabbit hole of it doesn't get addressed. So it gets a little worse and gets a little worse. And the delaying process alone puts them behind the eight ball. But I guess I hear your message, and what I would say to listeners today of the program, don't be afraid to seek medical care. I mean, the best thing you can do is be educated to learn about your condition. And from what you're telling us, doctor, it doesn't mean it's always going to be a surgery option. So
Absolutely. Again, I identify myself as a surgeon. I enjoy doing surgery. It's a skill that I've practiced for a long, long time, but the vast majority of my patients are treated non-surgically. I'll typically, like I said, recommend physical therapy. There are options through the Aultman system across the county, so it's convenient for the patients. We have therapy clinics in Massillon, North Canton, Navarre, Alliance, Orville. So we really cover east to west, north to south pretty well. We've also got a new program that started about a year ago called the Aultman Back and Spine Center. And it's not truly a center. What it is a resource for patients where they can call one phone number to initiate the treatment process. And that treatment may actually be evaluation by a physical therapist and recommendation by that therapist before they ever see a physician, or even eliminate the need to see a physician. Once they, learn a little bit about their back, start exercises, the majority of these symptoms go away. If they go through all the non-surgical treatment, that's when we start talking about surgeries. And again, I understand, you never hear people talking about how well they did with their back surgery. You always hear how bad they did with their back surgery. The people that don't do well are the only ones that talk. Everybody else goes back about their business. So that's part of the education, and that I speak to my patients. I say, look, yes, you have a back problem, and there is a solution for it. You're not going to be 20 years old again, but we can get you back to work. We can get you back to playing golf, playing tennis, all the things you like to do, if we do X, Y, Z. Some of those surgeries involve minimally invasive techniques where we can get the patients in and out of the hospital the same day with relatively quick recovery. Some of them are bigger operations where we have to keep them in the hospital and go through rehab to get them through there. I also work with the pain management physicians here in town and work with them with some surgical techniques to help simply with pain management, which is typically not as invasive as a formal quote unquote spine surgery.
Interesting.
So you mentioned the new phone number. Do you want to share that with the listeners so that, and maybe, I can see how that is a very low resistance way of getting an opinion of the problem you have. It almost sounds to me like it's a nice way to kind of, I don't want to, maybe triage is the best way to find out what kind of care the patient needs. Am I on the right path there?
I think that's a great way to describe it. Yes. So it's 330-363-2225. And a physical therapist will answer the phone. They will take a history of similar to what I would do in person. And there are certain red flag responses. And if the therapist hears these red flags, that will indicate they need to call me or one of the other spine care specialists to see a physician now. If they don't have any of these red flags, then they're probably a good candidate to go see a physical therapist right off the bat, have a physical examination, and then recommendations for non-surgical, low stress type treatment. No white coat at that point. If they go through all that and they fail to improve, then they're already in the system, and the physical therapist can say, okay, well, we can contact Dr. Cochran. We can expedite the process of getting in to see a physician all the data is already collected. So when they come to see me, it's kind of a smooth transition.
So I'm also going to make the assumption that, like if a patient went to their primary care doctor and they said, doctor, I've got this problem, and does the patient need to still call that number to get routed to you, or can they call your practice directly, or how does that referral part work?
Our office takes direct referrals from patients, as long as their insurance company does not require a primary care referral. They can also be referred by their primary care physician, and again, pass the information on to us, and then through the back and spine center. So, and then our other source of referral is through the emergency department. A patient that has an acute episode, the emergency room physician will treat them short term, but give them instruction to follow up with us and send us the same information so that we can get them into the office and start working on getting them better.
Take a break now.
Yeah, I think it's time for the news.
Okay, gang. It is the bottom of the hour. Time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. This morning, we're talking with Dr. Jeffrey Cochran with Aultman Orthopedics and Sports Medicine. So I think we solved the question about getting an appointment, correct, Brad?
Yes.
Okay. Doctor, you told us about your area of specialization. What about other areas specialization are available from Aultman Orthopedics and Sports Medicines?
Sure. So our group consists of 7 board certified physicians, 6 surgeons, and 1 primary care sports medicine physician. So that gives us the opportunity to address just about any type of orthopedic problems, from fractures, hip and knee replacement, shoulder replacements. Our physicians are trained and use robotic assistance for their knee replacements. We offer hand and upper extremity surgeries, shoulder surgeries, knee surgeries, and then, like I said, sports medicine. And that includes comprehensive care of the athlete, not just orthopedic issues, but everything that an athlete may suffer from, including skin problems, concussions, all the things we don't hear about on TV. We always hear about all the bright things and life-changing things, but it takes a lot to keep an athlete going, and having somebody with the expertise in the non-surgical realm is really a great asset to the group.
I'm curious. I would suspect that as far as sports medicine goes, the football time of the year is probably the most incidents of accidents of broken bones or whatever, as opposed to baseball or track or whatever,
Yes, the fall season in general seems to be busier. You mentioned football, and certainly that gets the spotlight, but soccer actually has a pretty high rate of injuries as well, both lower extremity injuries and concussions, things like that. So yeah, the fall season is very busy, and we provide care for the University of Mount Union, Malone University, multiple area high schools. So all of us, I personally am not a team physician, but most everyone else in the group does have responsibilities for a specific team. So.
Wow, interesting. So what's the most rewarding part about being an orthopedic physician?
Yeah, so I thought about this many times, and it might seem strange, but a very rewarding thing is when I'm out in public and someone recognizes me and I don't recognize them, and they tell me, well, you did back surgery on me. And I said, well, that means that I didn't see you very often, so we didn't get to know each other very well. And so I did my job. And that patient's out in the community, not suffering from chronic problems, and I helped them get there. That's very rewarding.
I've been around as a pharmacist for quite a while, and the advances in orthopedics is just amazing. I had an issue some time ago where they wanted to shoot my spine with some injections, and I thought, oh my God, what, what's that gonna do? What's that about?
Yeah,
How bad am I gonna be? I'm pained out, all that stuff. But actually, it was very sophisticated, and really walked out of the room and without feeling like I was half dead. It just
sure,
it
sure.
just is it's one of the questions that's probably not on the page today. There's a lot of older folks that are walking around with just a bend in their back and limping over. And what I've always thought is are those have been individuals that just they are older, and are those individuals that at the time that something happened to them, that we didn't have the technology and the advancements to make sure they were going to reach their older adult life and be walking straight up. Is that accurate?
Sure. Yeah. Well, I mean, there's different reasons for that forward bent posture. A very common one is simple spinal stenosis. So the stenosis is a narrowing of any tubular structure.
Yeah.
So in my older patients, I'll use the analogy of cast iron plumbing we had back in the day, and the rust would build up inside that plumbing till eventually the water just doesn't flow through. Well, our spines, as we age, get a little rusty. We get bulging discs and bone spurs and thickening of the ligaments that narrow the space available for the nerves. There have been studies shown in cadavers and CTs and MRIs that when a patient or when a spine is bent forward, it opens up the space by up to 30% and gives those rooms more space to function. So that forward bent posture is many times because the patient's natural response to that stenosis, and the longer they bend forward, then it changes the mechanics of the spine. It becomes more and more difficult to get them standing upright, even with a surgery. And that surgery doesn't necessarily mean putting rods in their back to straighten them up. It's getting the pressure off the nerves so it doesn't pinch the nerves every time they try and stand. Then you've got your scoliosis and different types of deformities, certainly, but probably the person that's out walking and bend forward or leaning on a walker or a cane, they probably have spinal stenosis.
Interesting.
And that is a correctable problem.
Okay, so the therapy, the spine has circulation of blood and also has the nerves in two different parcels. Is that correct in the spine?
Yes.
So when we damage the spine, we got a good chance of damaging both circulation and nerves, and thus a damaged spine halfway up your back can make your feet numb, and all that sort of thing.
Absolutely. Yes.
Okay.
And that's part of the history we do in the exam. There are certain physical findings that we can see in these patients, reflex changes, strength changes, sensation changes. And you mentioned the progress over the last 30 years. I happened to come through my residency training and fellowship at the time when a device called a pedicle screw was really being developed. Dr. Steffi, who I did my fellowship with, was one of the first surgeons in the world to implant these devices in the spine. And we've seen this go from the mid 80s to now to the point where we're putting them in through tiny little skin holes, passing the rods under the skin and never having to peel the muscle off. The injection therapies that you mentioned have changed as far as our technique, our precision, just because of imaging. I mean, I tell my residents now, they can't believe it, that there were 3 or 4 MRI scanners in the state of Ohio when I was a resident.
Mm.
Now there's probably three or four MRIs in the Aultman system, maybe more, with the mobile MRIs that go from site to site. So that's a tool that has revolutionized what we can do in the spine world as far as making a diagnosis. You can't treat a problem until you know what the problem is, and that MRI has really changed our practice.
And I've had a couple of MRIs, and they all both had to be approved prior authorization with insurance. Is that typical, or is that changed?
No, that is very typical. It's easy to reflexly order an MRI. Patients will ask me for an MRI, and I tell them an MRI is not going to make you better.
Mm-hmm.
The insurance companies have adopted a policy that patients need to fail non-surgical treatment before they consider an MRI, because an MRI is a pre-surgical diagnostic study. We don't do them just to say, oh, let's see what's going on. They're expensive. So, obviously the insurance companies are committed to savings if they can. But if a patient has the red flags that indicate the need for an MRI, they will approve them without the therapy.
Okay. I just thought that was interesting, and I realize that the equipment itself is very expensive, but like you said, there's a lot more of them in the area, and the hospitals and clinics and all that kind of stuff compared to what it was like years ago. So
Yes.
Can you tell our listeners a little bit about Aultman Back and Spine Center?
So we established the Back and Spine Center a year ago. It's picking up speed, but we basically did it to give patients more streamlined access to the system. The traditional medical system, you have a complaint of back pain, you call your primary care doctor, and depending on how busy or how much help that doctor has, it may take days to weeks to get in on occasion. Or a patient may say, boy, my back really hurts bad, I'm going to go to the emergency room, which is probably not necessary. Again, using resources that don't need to be used, unnecessary expense, time, all that kind of stuff. So the Back and Spine Center allows them to speak to a healthcare professional that is dedicated to the treatment of spine and musculoskeletal disorders, and get the initial evaluation out of the way so that they can direct them to either home care, physical therapy, or a surgeon if necessary. Okay. So we found that the patients like it. They have a little bit more control as with their healthcare, instead of just sitting and waiting. They get immediate feedback. It's someone picks up the phone and talks to them. It doesn't go to an answering machine. It doesn't go to a secretary who says, put you on hold or put you on a schedule for sometime in the future. You get feedback right now.
Okay, our final break is here, Doctor. You are listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. This morning, we're talking to Dr. Jeffrey Cochran.
All right, Doctor, can you let our listeners know where your Aultman Back and Spine Center is located?
Well, the Aultman Back and Spine Center is located on a telephone, 330-363-2225. But the sites for treatment are at all of the Aultman physical therapy satellites. So Canton on Tusk, here in Massillon at the Aultman Massillon building, Carrollton, Navarre, Orville, and Alliance, where our other orthopedic office is located. So it's convenient for patients. They don't have to travel to one central location, but can be treated in as close to their neighborhood as possible.
I'm thinking about I don't know, I don't like to admit it, but it's fall, and we're going to be out in the yards doing yard work and cleanup here and raking leaves and lifting stuff pretty soon if we aren't already. Can you give the listeners some tips of best practices to not maybe cause a self-injury of your back? Do you have tips that you would share with people that might keep them out of trouble?
Sure. Well, I think, I mean, one thing we all have to do is understand our limitations. I'm not 20 anymore. Most of my patients aren't either. And so they have to realize, realistically, just to go from being a sedentary person to all of a sudden lifting heavy bags of wet leaves that, weigh 40, 50, 60 pounds may be too much for them. I think to start out, you have to act like an athlete. They call it the term industrial athlete is a term we use in the occupational medicine field. So what's an athlete do before he goes on the field? He stretches out. He makes sure that the bones, joints, and ligaments are stretched and ready to do the job. I would say if you're doing a leaf cleanup job, keep your leaf bags lighter rather than heavy. It may take you a little bit longer to do it, but your risk of a back injury is much lower. Lifting in using proper ergonomics, so keeping the weight you're lifting close to your body and use your legs to raise it, and avoid twisting with that stress on the spine. So if you need something on the right, then you step to the right and face it. Don't step and twist. That puts a lot of stress on the discs in your back, and I see many injuries that result from that. Some things you can't avoid: the slips on the ice, the slips on the wet leaves, and things like that. But if the muscles are stretched and warm, they're less likely to be injured than someone that just goes out without preparing to be active.
Well, and don't overlook the opportunity to ask a neighbor for some help, right? I mean, like you
There you
said,
go.
we're not 20 years old anymore, so I think sometimes we forget what we're capable of, myself included. So it is something to keep in mind that you got to take care of yourself, because especially with your back, I mean, I think you don't appreciate how important it is until you sprain, strain, or injure something, and you realize how much of an impact it has on your daily life. So
Absolutely.
any other tips? All your comments there are good. Before in the show, you mentioned that sometimes with like physical therapy treatments, it ends up having some core training to help keep you strong that way. Any general exercises or any general things people could do just to give themselves a healthier back chance, if you will?
Sure. So patients will say, well, I go to the gym. What should I do? What should I not do? There's a couple of machines or activities that I discourage them from doing. If anybody's been to the gym, you see the rotating activity, the love handle machine that's supposed to tighten up the oblique muscles. I think that puts a lot of stress on the disc in your low back, and I recommend against that. Your high level athletes and even your high school athletes, they do their training with the athletic trainers. And our trainers are out in multiple high schools to help with their training and their rehab. But an overhead press actually puts a load on the spine that I think is unwelcome. You can train those same muscles, especially with the new ergonomic machine. I guess I shouldn't say new; they're not that new, but they're in practice where you can train muscles without putting the stress on the spine. What should you do? Core strength. I know when I grew up, there was a great emphasis on doing sit-ups, and then it progressed to crunches. I actually discourage crunches. I think a better exercise for that is planking. The spine's in a more natural position, and you're still contracting the same muscles to strengthen them without putting that force on the discs and the facet joints. If you're going to start a program, certainly the Back and Spine Center is a good resource for that. Have an evaluation. The therapist or trainer that's working with you will help you build a program. Then you can go to your local YMCA or your basement or wherever you happen to work out and exercise correctly. I mentioned earlier, a lot of my patients say, well, I work hard, I lift a lot, I do this, I'm on my feet all day, but well, that's the wrong thing for your back. You need to take that time out and train those muscles appropriately so they protect the spine.
Interesting. Wow.
Well, and to your point too, I've been a guest at one of the Aultman physical therapy facilities in the past, and it's very interesting to learn more about your body parts and what they can and can't do, or how you should be doing an exercise. Just because you think you know how to do it doesn't mean it's the right way. So
Right.
that's something to keep in mind too. So don't be afraid again to seek help. We're coming close here, Doctor. Do you want to, any final thoughts that you want to share with the listeners about overall good health or good practices on your part?
Again, I'd like to thank you for the opportunity. It's been interesting to discuss this today. I would encourage the listeners that have back or orthopedic problems to give us a call. We're here in Massillon, serving the Western Stark County, 330-837-8391. Our other physicians work at North Canton at the Aultman North Building and out at Alliance at the Alliance Community Hospital. Any of them can be reached through 330-596-6500. And again, the Back and Spine Center is a great resource. I think it's unique that patients have the opportunity to access a healthcare professional and speak to them directly without delay.
Interesting. Well, I guess we better close the show then. Unfortunately, we'd like to talk to you for another hour, Doctor, but it's not going to work. Okay.
Very good.
Thank you to our guest, Dr. Jeffrey Cochran with Aultman Orthopedics and Sports Medicine in Massillon. If you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsor, Aultman Health Systems. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we will see you again next Friday right here on News Talk 1480 WHBC.